details about that later in the press conference. So Dr Young and Bob G, our Director General of Youth Justice, will be addressing more details about that case. So we currently have 8 active cases, and we've had over 9,700 tests in the last 24 hours. So well done, Queensland. So what is really important for Queenslanders today is if you are sick, stay at home and get tested. So what you're going to hear today is a story of a woman who was sick and still went to work. So it is really, really important, Queenslanders, that if you are sick, you must stay at home, because now a whole lot of contact tracing has to happen. So we've had, Dr Young will also address the case of the Japanese woman in more detail, and I know that Dr Stephen Miles has also discussed that this morning as well. But this new case that we are concerned about is a woman in her 70s. She lives in the Ipswich region, and the contact tracing is now happening because she worked at the Youth Detention Centre at Waikol. So Bob G will give more details there, but in some good news, there hasn't been visitors at that Youth Detention Centre because of our concerns with those young women who came back from Victoria from the 27th of July until Monday. So that's a whole lot of contact tracing that does not have to happen because those strict measures were put in place at the Youth Detention Centre. I also want to reassure Queenslanders that we have very strong management plans in place for events like this, and those plans are now being activated with the staff of the Brisbane Youth Detention Centre and also with Queensland Health. So Dr Young will address that in more detail. But as I said, it is absolutely imperative during this time that Queenslanders, if you are sick, go and get tested, because we now have all that contact tracing that needs to happen. We'll be speaking with her close contacts, with her family members, to try and identify a connection of where it has come from. So look, I'll hand over to Dr Young and then to Bob G, and then we're happy to take your questions. Thanks, Dr.
So yesterday we were notified from Japan of a case who travelled from Brisbane to Sydney to Tokyo, was tested on arrival in Tokyo and found to be positive. So we've now gone back and looked at the history of this particular individual. So she travelled from Japan to Australia in the middle of July. She went into quarantine in Sydney and had 2 weeks in quarantine there. She had 2 tests done and both of those were negative. She then asked for an exemption for here in Queensland that was given to her to visit her unwell father in Morningside, Bulimba area in Brisbane. So she flew directly from Sydney. She left the quarantine hotel in Sydney, flew directly from Sydney into Brisbane and went and stayed with her father. She spent 2 weeks there. Then on Tuesday, she travelled back to Japan, travelling directly from Brisbane Airport on a Virgin flight down to Sydney and on to Japan. Now, at this stage, we're contact tracing all of her close contacts. At this stage, we're aware of 6 who we've tested, and we should get their results late today. We also have been able to speak to her to find out where else she's been. So she identified she went to the jam pantry in Greenslopes on Sunday morning for breakfast. So she was there from 9:45am to 11am. So anyone who was at their jam pantry during that time frame should come forward and get tested. Anyone who is at the jam pantry during the rest of the day who develops any symptoms at all in the next 14 days should, like any Queenslander of course, come forward and immediately get tested. Then people who live in that Morningside, Bulimba area, at this stage we don't believe that she went to any other venues for any significant period of time, so there is really no concern there. But again, if anyone who lives in that area becomes unwell with any symptoms, they should come forward and get tested. And Metro South Hospital and Health Service is putting in place additional hours for all of their clinics to enable that testing to occur. So we believe that the risk from her is very low. We're not sure where she's acquired the infection, but we believe that risk is very low. Now, the second case, so that won't count as a case in Australia because it's been diagnosed in Japan. It will be counted as a case in Japan, but we, of course, are managing the time that she was here. Now, the second case is a lady in her 70s who lives in the Ipswich area. And she developed symptoms, we believe, on the 10th of August, although that is all being clarified. We only got the result for her late last night. So we're just working through with her all her contacts at the moment. But she has worked at the Brisbane Youth Detention Centre, and she worked there for 5 shifts while she was in that infectious period. So we go back, remember, 2 days prior to when symptoms first developed. So from the 8th of August. So at this stage, we're working with the centre to test all of their residents. They have approximately 130 youth in detention there, and all of the staff. There's over 500 staff. Plus, we'll be going through whether there have been any visitors during that time period, and whether, of course, there have been any residents who've moved in and out of the facility during that time, to test them. For 2 reasons. One, whether they've got the infection now, possibly from this lady, or to try and see if we can find out where she might have contracted the infection. At this stage, we're not aware of any venues that she's been to that those young women who went down to Melbourne, that cluster of 5, have been to during the period. But that's the work that we'll now be doing very thoroughly over the rest of today to work out all of her contacts, where she's been and where she might have got this infection. So there are 2 cases that we're just working through all of the contacts and where people might have been and who might have been infected. Now, while we do that, of course, it is very important that anyone who develops any symptoms, has any symptoms, comes forward immediately at any time and gets themselves tested and isolates themselves until they get results. That is really important. We don't know when our next case might appear in our community, and the best way to defend against it is for people to get tested as early as possible and to not go out in the community and not go to work while they're unwell. The other thing is that we do have to maintain that social distancing, because that's what will protect us from seeing a spread from any cases. And again, we don't know where these cases might end up. And the third is that people don't go to areas where we know there are large numbers of cases. So that's New South Wales, Victoria and overseas. And we are still seeing Queenslanders, for many different reasons, travelling interstate. This is not the time to travel interstate. Everyone should reconsider their need to do that. Thank you.
Thanks, Bob.
Thanks, Premier. Good morning, everyone. So you've already heard the Brisbane Youth Detention Centre at Wacol is in lockdown. Last night, we were advised by Queensland Health that a staff member had tested positive to COVID-19. We've been practising and we've been workshopping and, of course, testing our systems since COVID first came to light. So I'm very confident that we're doing everything we can to make sure that all of the staff, all of the young people, visitors, families and friends are supported. Can I just make a couple of quick points, some facts? Personal protective equipment has been issued to all staff. They've been trained in how to do that. Personal protective equipment will also be provided to young people, has been provided to young people out there on the centre. I've never seen more health professionals at the Brisbane Youth Detention Centre than there is out there today. Any new admissions to the centre will not be accepted. Any new admissions to the centre, of course, will not be accepted. Can I ask people to stay away from the Youth Detention Centre? We have police out there doing what they do best, helping us keep people away. The best thing we can do is let health get in there and work with us to make sure we have the safest possible environment for the community. Just a couple of other quick facts, if I can, please. There will be no court appearances. There will be no education instruction at the centre today. We have plans in place, of course, for young people to be given support in terms of education, health, contact with family, and those processes are being put in place. It's a virtual world that we live in now, so we'll work through that today and over the coming days to make sure that we provide the best support we can to the young people that are there, but importantly, staff, family and friends. Some other facts: there's 127 young people out at the Brisbane Youth Detention Centre today. 110 of those young people are male, 17 are female, and the ages range from 13 years and 6 months upwards. There's about 520 staff that work at the centre, not all at once, of course. The majority of them are youth detention centre workers, but also education and health professionals. As the Premier indicated, we took a conservative approach at the Youth Detention Centre, and face-to-face visits at the end of July were cancelled and only recommenced this Monday, the 17th of August. We're well placed. Every day, no one can get into the Youth Detention Centre, myself included, without having their temperature checked and being asked a series of questions about their own health and who they've been in contact with. Very, very strong processes in place there. I've got to say to anyone out there that's been in contact with any young people that they think have been at the Youth Detention Centre that they should seek advice. But to family, friends and staff, we will come to you directly. It's a great machine that we've got in terms of disaster management in this state, and we've got that practice well down at the Youth Detention Centre. We've practiced for this, so we'll be providing information as soon as we can. That's all. We're open to questions, I think.
What's actually happening in the facility? Because you can't socially distance in there. Are some of these youth being taken out into other areas to make sure that there's only one person per cell? Like, what's actually physically happening?
So it's not the first time we've had infectious diseases in a youth detention centre. We're well practiced at locking down. And whether that's for a security reason or a health reason, we're well practiced at that. So what's actually physically happened, last night all of the young people were locked in their rooms and they stayed there. So we'll have, using personal protective equipment and well-trained staff, support for them for as long as it takes for health to move through and do what they need to do in terms of checking.
And do you know how many may have been released back in the community since that August 8th?
I can't give you an exact figure, but we're working through that with the State Disaster Coordination Group, police and health.
Is there any plan to try and make sure that the youth there are in one to a room? I mean, I said that's not really possible, but you know, if we're all trying to practice social distancing, how can you do that if you're all in together? Can
I make it really clear? Overwhelmingly, every young person is in their own individual room. I really would doubt that there is any that are doubled up. From time to time that can happen where people are related or want to, but we had already yesterday made sure, last night I should say, made sure that we put in processes where people were separated, not just the young people, but staff.
How much contact does this woman have with inmates?
The good thing about a youth detention centre is all movement within reason is tracked. There's significant, and I think you all know this, significant CCTV footage. So we'll be able to work through all of that as best we can. I would say though, the advice I have initially is that her contact was limited to only a very small number of young people. She has not worked walking through the accommodation section. She's worked in the operations centre. So she's a supervisor.
Can you just confirm the 500 staff and the inmates, will they all be tested?
That's a matter for Queensland Health, but I suspect that we'll take a very conservative approach and do whatever it takes, not just those, but that other people that have been visiting and all of those sort of things. So today there's a big machine out there.
What happens, obviously, those staff are going to have to isolate at home until they get their test results now. So, and Dr. Young has just said that, yes, they all will be tested. So So where are you going to get 500 staff from at a moment's notice?
We've got plans in place for that. So we don't have, obviously, 500 staff out there working at one time. The Youth Detention Centre cohort is under 400. We've got really well-developed plans because it's not the first time that this has happened. In terms of, I shouldn't say, in terms of having staff shortages. So we're well placed in that space.
What does it say about protocols and processes? I assume, given the sensitivity of a facility like that, there'd be a lot of messaging to staff, like we always hear, not work while sick. What does it say? This is a clear breakdown. This woman has turned up to shifts whilst
I think it's early days and we should be really circumspect about what we've got. Health are doing a great job working, and I want to point out that staff member, we're concerned about her ongoing health, but I think it's very early days and too early to jump to conclusions.
Have there been any extra measures taken other than temperature testing or prevention test? There's no mandatory testing of staff on a routine basis that would pick this stuff up. Is there any extra level of security that's been implemented during COVID to stop someone turning up to work who was clearly infectious?
I can go into a whole heap of detail, but from the basics of cleaning, every day, 7 days a week, there's an industrial clean through each night. So we've increased cleaning, all of those basic things that keep people safe. Staying your distance, washing your hands, all of those things, personal protective equipment. And for me, the point now is how do we go through the process and make sure that everyone that needs help gets help.
Are there any legal issues with enforcing mandatory testing in these youth now, given that they're underage, you require permission of parents, guardians, things like that?
As I understand the law, between my legislative abilities and the Chief Health Officers, we can work through all of those scenarios.
Can I ask about Japanese? Sorry, what sort of test did she have when she arrived back in Japan? And has Queensland Health asked for or been refused by?
Sorry, what was the second part?
Has Queensland Health asked for or been refused a blood test?
So my understanding is Japan doesn't do serology testing routinely, so that's why it's not being done there. She had a PCR test, so a swab test, so the one that you do for acute symptoms to see if there's any virus.
But did she have that because she had symptoms?
No, she had it because she flew into Japan and everyone gets tested who flies into Japan.
Do you know how, is she a dual citizen? I thought our borders, international borders were closed. Do you know how she got in or?
The Commonwealth gave her permission to come in.
Is she an Australian citizen?
I don't know those details.
There was no requirement once she had an exemption for quarantine when she was on cruise.
No, because she'd completed 2 weeks of quarantine in New South Wales with 2 negative tests, and she went directly from the quarantine hotel wearing PPE to the airport and then came to Queensland.
So is it highly likely that she didn't get the, hard to tell, but it's likely that she didn't contract the illness here, that she might have got it, say, on the flight back to Japan or something like that?
I don't know where she's got it. She could have had it before she came to Australia and have recovered and just be excreting virus later. We've seen that in quite a few cases. She could have got it in Brisbane. She could have got it on the plane going back to Tokyo. We really don't know. The most important thing for us is to contact trace and to test those people around her. And if all of those people are negative, then I think we can say this is a very low-risk situation.
At the Youth Detention Centre, presumably a number of those children would be in the vulnerable category, Aboriginal and Torres Strait Islander children.
Yep.
So what extra precautions are being made for those youth? Are they being monitored around the clock, or what happens with them?
Just remember that this disease for most people is quite mild for the first 5 days. So we will be going in there, we're in there this morning, and we'll be testing every single resident who's in there this morning.
The real concern of my concern of weight, I guess, is the fact that when children
Yes,
get it,
yeah.
which shows that it's still out there in the community.
Yes, you're correct. Yes, it is a concern.
Has she been able to provide you with a detailed list of places she's visited?
That's what they're talking to at the moment. So remember, we got this result late last night. So they've been working through the night and this morning talking to her again.
So would you expect a list similar to
Yep.
the one we had to be released today?
When we get that information, we'll release it immediately, of course.
Doctor, do you have an update on the two crew members on Townsville?
Yes, they're in the Townsville Hospital. They're reasonably well at this time.
Okay, and where is the rest of the crew isolated? Are they still on the
They're on the ship. Yes, so they'll be going out today and retesting all of the people on the ship.
And we had 6 active cases yesterday and
Yep.
8 today. Did you mention the Japanese case doesn't go on
No.
the rail list?
No. So there was another case of someone who's been readmitted to hospital. Yep.
So they,
So acquired interstate.
And this 70-year-old woman, woman in her 70s, she's in the higher risk category.
Yes.
How's her condition? Is she in hospital? Is she?
Yes, she's in hospital and she's reasonably stable.
and did she took herself to get tested? Eventually
Yes.
was picked up, and
Yes.
You mentioned that she was symptomatic for 5 shifts.
Well, no, she was infectious for 5 shifts. So her symptoms started on the 10th, but if we always go back that 2 to 3 days before, so she worked during that period as well when she didn't have any symptoms but was infectious.
Is an antigen test the same as a PCR?
No, antigen is serology.
Right, okay.
Yeah.
Premier, can we ask you a quick question on Qantas and Alan Joyce? This morning, Alan Joyce has said that he doesn't think the current situation with state borders is sustainable, and borders being closed to states with no or few active cases isn't a sustainable model, and he wants a national strategy set up to allow a better flow of domestic passengers within Australia. Is it time to have a national strategy on borders? Is
Well,
that
I think the national strategy needs to be focusing on Victoria to get all of their cases under control, and New South Wales, so then all of Australia can open up. That should be the national strategy, and I talked about that yesterday.
It's premature at this point to...
Absolutely, we will always take the advice of the Chief Health Officer to keep Queenslanders safe. So I'm not going to bend to anyone. It is a tough time at the moment, but Qantas is free to operate within Queensland and those other states where the borders are open for interstate travel.
has said that patients in northern New South Wales have been required renal transplants at the Alexandria Hospital. Is enough being done?
If there are, yes, there is enough being done, and if there are any individual cases, people can apply for an exemption and they can talk to, get a decision from the Chief Health Officer. But, let me make it very clear that health services are offered across the nation. Queensland health services are very strong, which is obviously why a lot of New South Wales people want to come to Queensland. But we also know that people travelling from Queensland do pose an increased risk when it comes to COVID. So we have to make sure we have strict measures in place, and that is exactly what we have. So we will work with those individual families on a case-by-case basis, but there will not be a blanket exemption for everyone. We have to protect Queenslanders. I'm showing a lot of decency, and it's about time that Greg Hunt focuses on aged care and the issues that are happening in Victoria and stop trying to raise every other issue about Queensland.
Premier, is your handling and your government's handling of this virus on the Department of Which to voters?
What I'm focused on is making sure that we have COVID under control, but as we've seen today, it can happen anywhere at any time. And all of our agencies are operating for swift action. Look how swift the action has happened. This was detected overnight. We've got Department of Health in at the Youth Detention Centre, and the detention centre's management plans have been activated because the government has been planning for this. We have been planning for this, and we will continue to plan for this.
Based on your comments today, there is no call to widening the border bubble?
No, definitely not.
Can you please elaborate? There were reports today that the Queensland government is appointing leaders from the Suns and the Lions to prepare Queensland's bid for the AFL Grand Final. Do you have any elaboration on that?
We will continue to work behind the scenes until the AFL makes a decision about the grand final, and that's all I'm going to say at this stage. Yes. Yeah, we're just finalising the membership of that committee, and that'll be announced shortly.
Have you received another letter from the Prime Minister today about choice as well?
Sorry?
Have you received another letter?
Today, not to my knowledge today, no. Yep, and then we have to finish up. Yep.
You mentioned that no more questions at this stage. So where are the kids going in the meantime, and how long do you think that will go on for?
So the immediate plan is for them to remain in watch houses, but we have significant capacity at Cleveland in Townsville. So we'll work through with police in terms of transporting them to Cleveland if we need to. But in the short term, they'll be in watch houses. Cleveland, though, off the top of my head, has at least 34 beds spare, which is a significant number because we don't have many numbers.
In the lockdown, how long will that last?
Be based on
14-day sort of period, or?
based on health advice, but I think we should expect it to be around there. I'm not going to go into the detail about that individual employee other than to say that she's very valued in terms of her experience. Thanks, everyone.